Healthcare leaders face lots of challenges, and that's what we're going to talk about today. All right, so I work closely with a lot of healthcare leaders who shape the future of patient care, innovation, and excellence in medical affairs and field reimbursement. But let's face it, behind every groundbreaking decision lies immense pressure. Today, we're going to take a closer look at some of the challenges that healthcare leaders and pharma execs face and how we can support them. Leadership in healthcare comes with extraordinary demands. Research actually shows that over 70% of healthcare executives experience chronic stress at some point. At the ACMA, we've seen it firsthand how these pressures can impact, for example, decision making and ultimately impact patient outcomes. These challenges are compounded by the complexity of the industry, rapidly evolving regulations, for example, maintaining compliance, and the critical responsibility of upskilling their teams. It's not easy. This is why through the programs that we offer, like the Board Certified Medical Affairs Specialist or BCMS program, and for example, the Prior Authorization Certified Specialist program or PACS, we equip healthcare reimbursement specialists, medical affairs, life science leaders with the skills their teams need and the knowledge and the tools to be successful. My mission is and has always been to help leaders focus on what matters most. Ultimately, that's advancing medical affairs, reimbursement, and improving ultimately patient care. The thing is this, leadership is more than just a title. It's about resilience, innovation, and impact. At the organization I run, the ACMA, we're here to support those who shape the future of healthcare and the life sciences. And although the UnitedHealthcare CEO situation was a terrible tragedy, what can we learn from it? I think what we can learn is that people are really frustrated with today's healthcare system more and more than we think, and that prior authorization obstacles really do impact patient care and quality of life. One of the things that we've been doing at the ACMA is looking at ways to partner with, for example, pharmaceutical manufacturers to support their healthcare provider offices, for instance, with education to help them navigate this complex system and web within the healthcare system, for example, around prior authorization. So by offering, for instance, certification and training education to healthcare providers. I'll leave you with a personal story. I have my own son who at the time was 9 years old, needed an MRI of his brain. At the time, we were told that we needed to wait several weeks to get the scan. Luckily, I was able to pay for the cost up front out of pocket and get the scan done that day. I didn't want to wait for the results. As you can imagine, as a parent, that was difficult. He's okay, thank God, but not everyone is fortunate enough to be able to do that. And this is why we need to better support both the frontline staff at doctors' offices and hospitals, but also look at the healthcare system itself at the macro scale level and what needs to change. What needs to change? All right, that's it for today. I'll talk to you all soon. Make sure you let me know what other types of topics you're interested in hearing more about. Make sure to subscribe, follow, and I'll see you guys soon. Stay well.